Here this morning with me, I have Dr. Ron Ellis. How are you this morning?
Fine, thank you.
Thank you so much for being on our morning show. We are talking a little bit about a new breakthrough pain technology. Can you explain a little bit?
Absolutely. It is a type of spinal cord stimulator system. Spinal cord stimulators have been in use in the United States since 1989, but this new system by a company called Nevro was just approved for use in the United States in May of last year. It has also been allowed by the FDA to use labeling that it is superior to traditional spinal cord stimulator systems.
And this is something that's being implemented here in Northeast Louisiana, correct?
That is correct. We've just started using it here within the last 2 to 3 months. We're the first in this region to utilize this specific technology. The next closest place where it's being utilized with any frequency would probably be Jackson, Mississippi, and as far west as Tyler, Texas.
And so what type of injuries would people that are affected and experiencing pain, what type of injuries?
This is for use in patients with chronic long-term pain that has not been effectively responsive to other types of treatments. And
they can get that information where?
They can find information on our website at lapaincare.com. They can also contact our office and request information or be referred by their physician to us for evaluation.
Okay, alrighty. And I know that you had a demonstration here that maybe you wanted to show us of how it works.
Basically, in effect, the way it works is by using low amplitude electrical current, we're able to stimulate the spinal cord indirectly without actually being in the spinal cord and effectively block pain signals from certain parts of the body reaching the brain.
Right, wow.
Traditional spinal cord stimulators in the past, up until this system, utilized rather low frequency stimulation so that the patients did feel buzzing or tingling sensations, what we call paresthesias, instead of or to replace the pain sensation. But unfortunately, with many patients, those paresthesias are uncomfortable and are variable with position. Also, they should not be used while the patient is driving, for example. With the new Nevro system, it uses a high-frequency stimulation up to 10,000 cycles per second. And at that rate, the patients don't feel any sensation other than a reduction in their pain.
Wow. Well, that's definitely a plus to
absolutely
increase the quality of life for these patients.
Very much so. There are many advantages to spinal cord stimulation, but once again, with the new Nevro system, that's the big plus there.
All righty, Dr. Ellis. Well, thank you so much for coming on again. Can't speak. And we will have this on our website as well, myarclemis.com. Stay tuned.